Discovery Health says it's ready to vaccinate its members as soon as enough vaccines become available. In a mail sent to members over the weekend, Group Chief Executive Adrian Gore said the company is making an unprecedented financial and human capital investment in their own mass vaccination program. It believes it has the capacity to vaccinate 50,000 people a day. For more on this, I'm joined by Dr. Ryan Noach, Discovery Health CEO. Thanks for your time, Doctor. Appreciate it. So I'm also reading this. You're apparently in contact with all COVID-19 vaccine producers, but of course you can't independently source and distribute the vaccines because governments are dealing with that now. Talk to me then about the point of these talks with these vaccine producers if you can't really secure it yourself.
We've actually, and thanks very much for having me, we've actually been in conversation with the vaccine manufacturers since September 2020. We've had ongoing conversations. It's very important that there be a centrally coordinated national campaign. This has been demonstrated around the world to lead to better outcomes and to obviously assist with prioritizing those that are most at risk. Our government is handling the procurement. We're supporting them closely with that in the talks with the manufacturers. And we stand ready to vaccinate our members as soon as supply becomes available.
And then, of course, you're working on being able to vaccinate 50,000 people per day. Do you have any idea when that's going to happen in South Africa, given the current pace of the rollout?
We'll be ready by 1 May in order to commence that vaccination process. The cabinet announcement from government has confirmed that the private sector will be involved from May, and we're closely in conversation with the Department of Health to understand how the vaccine allocations will work. It's very important that we get the most at risk vaccinated quickly, and so we're doing all we can working with the Department of Health to try and get those supplies in early so that the most at risk can be done by midwinter, we hope.
Is there any way that Discovery could in future look at securing vaccines outside of government when we reach a point where government has secured enough by itself?
I suspect that in time, global markets will adjust when the supply-demand equation changes. At the moment, there is just massive global demand and inadequate supply. And so national coordination is being handled by governments in all countries around the world. But I would expect, probably heading into 2022, that demand-supply equation changes and that as a result, the whole vaccine market adjusts to the normal medicine supply chains that we see with many other important medicines.
And in terms of your members' rollout, will you adopt a similar approach whereas you will first vaccinate people who are at high risk and then move on to other people, or will it be on you register and you get the vaccination?
No, it's very important that we do vaccinate most at risk first. The Ministerial Advisory Committee has provided guidance on how that prioritization should be handled. In the case of Discovery, we have about 550,000 clients that we've already identified who meet those priority groups and definitions, and they must be vaccinated first. This saves the most lives and gets the economy kick-started much more quickly. And our actuarial models and estimates really endorse that.
Obviously, government says that the vaccinations will be free on its part, but will you be able to do the same for your members?
Yes, absolutely. Vaccination will be completely free for all medical scheme members. A government gazette was finalized and approved during December 2020, which has made vaccination a prescribed minimum benefit, or PMB, for medical schemes. This means that medical schemes must cover the cost of vaccination in full from their risk funds with no co-payment by the members at all. So this will be free to members of medical schemes.
And of course, we heard from the President, he's very optimistic that we will reach that target of vaccinating 40 million people by the end of this year. Some experts are skeptical. What do you reckon?
We are really optimistic and hopeful that this can be done. From a private sector perspective, we're doing everything we can to accelerate it and to be ready to be part of the vaccination campaign and support government's efforts. It is a big ask. We can only speak for our part in it, and in our part, we are ready to do 40 to 50,000 vaccinations per day from the 1st of May, and this would really make a big contribution to the national effort.
All right, thank you so much for your insight. Appreciate it. Dr. Ryan Noach, Discovery Health CEO.